Both levels of government felt that we were being alarmist, even scaremongering.
Advocates for Quebec's English-speaking community continue to denounce a controversial French language directive in the province when it comes to health care. Federal MPs are also following suit. NDG Westmount MP Anna Gainey took to social media Wednesday calling on the Trudeau government to intervene. She says she has serious concerns about the rules, which restrict the use of languages other than French in health sector communication in Quebec. Sylvia Martin-Laforge, Director General for the Quebec Community Groups Network, the QCGN, which advocates for the rights of English groups, says this isn't a language issue. It's a question of health and access.
The Canada Healthcare Act doesn't talk about language, no, but it talks about accessibility, which guarantees every Canadian to have reasonable access to insured medical, surgical, dental across Canada. The directives have got to be rescinded.
On social media, Mount Royal MP Anthony Housefather echoed MP Gainey's concerns, saying when it comes to health care, the language preferred by the patient is paramount, and Montrealers agree.
Because people's health are at line, they should be allowed to speak in the language that they're most convenient for them. Any mistake can cause big trouble to their health. So I think this is very risky behavior.
I don't think that language should be an issue when it comes to health. There's a lot of people here are immigrants and they don't speak well English or French, and I think that, they're really sick and we should try to accommodate them.
It makes people feel that they're not important, and that's not true. Everybody's important, and it seems like the government doesn't have that same view.
QCGN hopes to share their doubts with the Quebec government in a formal setting.
We had written to the Minister of Health, like over a week ago now, asking for a meeting. And we've received an acknowledgement that they received the letter, but we've had no offer for a meeting. We heard on Twitter in French that the Minister Roberge was going to meet with English-speaking community.
City News reached out to Quebec's health ministry, who told us to contact Minister Jean-François Roberge's office, which we had previously done. We were then told Roberge would only be available to comment on Friday, a day after this report.
The ultimate solution would be a solution that we had asked for, that Bill 96 at the time, as part of the charter now, not apply to health and social services.
In Montreal, Anastasia Dextrene, City News.